Hello, how's everyone doing? Oh, let's just sit down, it's easier on the angle. All right, Dr. Erickson, Essential Motion, Spine and Sport, and Executive Health Solutions. This video is for those who are having low back pain, but to be honest, it will not be effective for most. This will not be in a video that will be the right movements and directions for the majority of people that have low back pain. This is definitely for the probably the 20% that don't respond to the normal directions that we see. Most people with lower back pain have a pretty specific directional preference, meaning if they move into a direction, maybe two different directions, they can usually resolve the problem fairly quickly. For most people, that is actually moving into extension backwards, bending backwards. Usually this involves you falling into a category of kind of a grouping of symptoms. You have low back pain. It can be there all the time. It can be intermittent. It can come and go. You also will feel, you'll have increased pain and discomfort with sitting, with bending, and you'll feel better with like being up and moving around, changing positions, walking. You also will have possibly an obstruction to movement, where when you first stand up you feel stiff or stuck, and then after you walk it out it gets looser. That's the majority of people. That's where the vast majority fall into that category, and they respond well with extension. I've got a different video for that, a basic or an entry-level, beginner-level exercise program and movements to help with that. I'll probably post that in the link or in the comments below, but this video is for those that would be more of what we consider a flexion responder. So either someone who does not like walking and standing and that kind of thing is worse, sitting is better, but not necessarily. It doesn't necessarily have to be that way. Even with the other, the other one, you can either have some leg symptoms or not have leg symptoms. It doesn't matter. But at least with standing and walking and doing the extension, it relieves the symptoms in the leg. It brings them back up the leg. But that can happen with flexion as well. So I'm going to show you some different movements, kind of a basic, beginner level movements for the low back that would respond to some repeated flexion in lying, possibly flexion in sitting. And I'm going to throw in some rotation, just because not always. Again, this is really for those who have tried other things and they've kind of failed out of other. The easy ones are always easy to fix. That's why they're easy. These would be more for the more difficult ones to give it a try and see if it relieves that low back pain and changes your symptoms. What it can't do is that if you do it, it cannot put pain into your leg that stays. You can have intermittent little but it can't stay. Otherwise, that is wrong, and then we need to stop. So let's hop on the table. Let's go into like flexion. In line, so knees up here to chest, pressure on, pressure off, and try to get deeper and deeper every time. Deeper, deeper, further away. And so you get essentially what's called bottom up flexion. You're flexing from the lower bones, and it's kind of coming up. And you'll really feel it when you get way in there. All right. So good couple of flexions. All right. Okay, so I'd probably get a good 10 to 12 flexion in line. You don't need to go all the way back down. That's not important. Just stay right up in here and just flex. Okay. Then, if you're a right-sided pain, then I would go into up here far. Let them fall to the right, okay? And then you upper body back over to the left and just hold it and close down that right side, okay? So I'm just going to keep it right there. I'm going to work it up 30 seconds, 45 seconds, a minute, okay? Just keep going further. And then you come back out of it and rest. If you're a left-sided pain, then you're going to go up, over to the left, and then upper body back over this way, so you're closing down the lower left. Again, hold 30, 45 minutes. Just build it up, build it up. Breathe out. Let it really sink in. No muscle. This is not these are not strengthening. They're not exercises. They're just some positional movements that we need to move and change some things back here. Within the lumbar spine, in the bones and the joints and the discs, we're going to change some things. It's not an exercise where you're using muscles. You need to relax and let everything fall. Okay? Hold it. Okay. If you're in the middle, right in the middle, try both sides. See which one gives you the most relief or the biggest benefit afterwards when you stand up. Not while you're doing it. It's going to hurt while you do it. Okay? Just go for it a couple times and see. You just can't bring anything down. Okay? So again, if you're right-sided, go into the right. If you're left-sided, go into the left. Okay? Then we're going to go into a bridge and hold. Now this one is actually working muscles. This one you can kind of tense, all right? A little bit of tension in the muscles. The other two are not. They're not muscle. They're not exercises. This one is a strengthening. Okay? Okay, a good probably dozen or so of the bridges. Bridge, 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 bridge. Hold it. Tight. Muscles. If it's feeling pretty good and you're more advanced and you want to try it, go up, hold, kick one leg out. Don't let that hip drop down. Keep it tight, okay? Then switch. Left leg out. Don't let that side tip down. You got to keep it up. Use your muscles. Okay?
Doing some more.
Down.
Working on hinging through
Up.
the hips and really
Here. Hold. Okay. Down. Other side. Switch. Okay? That's more advanced. Alright. Then go to one leg up, toe back. Push and hold hand over hand. Your leg's coming this way. You're blocking it. Okay? So push and hold 5 seconds. 1, 2, 3, 4, 5. Switch. 1, 2, 3, 4, 5. Switch. 1, 2, 4, 5. Switch. 1, 2, 4, 5. So back and forth. This one you are using your ab muscles, your hip flexion muscles. This one I do want to use a little bit of muscles on. Remember the first two, the knees to chest and the one to the side. More of a movement, more of a stretch. It's not an exercise. It's not strengthening. These ones are kind of a sub-maximal strengthening, okay? All right, from there, up, retest. Let's get this at a different angle here. Like that. Retest your motions, okay? How are you feeling? Side to side, hips to the side. How are you feeling into flexion, into extension, okay? If those movements are correct, you have to by the fact that the mechanical problem in your back, you have to be moving better in all directions, moving better to the front, moving better to the back. If you're locked up and now I can't move backwards or I can't move to the side, this, like I said, may not be right for you. This is not going to be a great combination of movements for the vast majority. This is for the minority of people that have tried other things that might be good for them. So I'd go with those for right now. And then I'm going to make some more videos that we'll kind of play off of that, and we can advance to some more, hip and strengthening in the hip, the glutes, the abs, that kind of stuff. So try the flexion, knees to chest. Oh, the other way to do it would be this way. If you want to add a little bit of flexion in sitting, I'd go like this on the edge of the table, and then you bend down between your legs and bend, flex, 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 flex. Okay? And come back up. That's pretty aggressive flexion, okay? Flex, flex, flex. Even I have there's a little bar under the table here that I can kind of pull on and really pull yourself back. Flex, flex, flex. All right? That's the starting point. Give it a try. If that's not working for you, if you're having any kind of increased pain or loss of mechanics, loss of motion, any kind of, or peripheral away, symptoms that are in the, further into the leg, calf, foot, that stay, don't do this one. take it, like, watch a different one. This is not for you.